So Max, it's all you whenever you would like to start.
Excellent. Well, hello everybody, and I'm really sorry for the delay. But my name is Max Alcocer. I'm the outreach coordinator at the Miami VA. I'm also a veteran. I retired out of the Army back in 2008. I was in Iraq a couple of times. So for the last 12 years, I was doing benefits with DoD. I was doing a lot of the disability ratings and all of that. But now I'm with the VA, and I basically kind of do the same thing, but um, with some differences. But I'm here. I don't know what kind of questions you might have, what kind of issues, and I'm here for you guys. So
So,
everybody,
oh,
go
go
ahead,
ahead.
go ahead, man. No, go ahead. That's fine.
Oh, I was gonna say, so I was gonna say, can you just maybe walk us through, some common, like frequently asked questions that you guys come across or cases, and then like how you navigate through the process and are able to help, the military and veteran population?
Sure. So, let me see benefits. Um, as a veteran, we have several different benefits. It's all up to whatever everybody's looking for. Let me see. The number one thing that I think every veteran needs to take a look at is the healthcare. Healthcare, because you know what, we are not getting young. That's a fact. So we are going to be needing healthcare. And as a veteran, you have the VA for your healthcare. Obviously, you got to enroll and you got to register. Now, one other thing that you as a veteran needs to do is at least do one physical a year. That is what every veteran needs to do. Me, myself, I retired out of the Army and I got a TRICARE, so I got my own health insurance. But I do my VA physical once a year with the VA, just to be on a good standing with the VA. Besides, you never know. One day I might need the VA at least as my secondary insurance. And since I'm doing my physicals with the VA, I'm gonna be in good standings with the VA, and therefore I should be able to use that. Before I jump into another benefit, I'm gonna give you an example of what happened about 6 months ago. I was I was at the Miami VA and I was doing something else, and there was a gentleman that came out looking for me that works here at the VA, and was telling me that there was a lady somewhere like early, in her 80s walking around the VA trying to do something, but no one really knew what she was trying to do. So I ended up talking to the lady. What happened was that her husband was a Korean vet, and he was an inpatient in a clinic in downtown Miami. So the gentleman was there now mid 80s. He was there for about a month, and he was running out of money. So what happened was that I after I got the whole story was that the gentleman who was the veteran got out of the service back in the 60s and got a good job here in Miami. So he never really worried about coming by the VA to get enrolled, to get anything done with the VA. The wife, she said that she kept bugging him about maybe coming by the VA, getting everything squared away with the VA, but the gentleman kept saying that they were doing fine and that they didn't need the VA at the time. So now he's 80s, he's in his mid 80s. He was an inpatient in a clinic, and the wife, who was about a 79 or 80, about at the time, was walking around inside the VA trying to enroll him and trying to register her husband. Obviously, the lady didn't have a clue of what a DD-214 was. Didn't have a clue of what kind of document she was going to be needing to register or get him enrolled in the VA. And I kept thinking to myself, Why wait until something happens to you, or why wait and put maybe your significant other under so much stress when you can do it yourself? It is something that every veteran should do. I think get enrolled, get registered, just in case. You never know what's going to happen in a few years from now. That's one. And if you guys want to enroll, you guys want to register, it's easy. It's really easy. It takes you about 5 minutes. All we got to do is put you on the system. And that's it. Now, the other benefit that I know that everybody is it's always asking questions about is the compensation, the service connections. Service connection disability, it's a disease or an injury that happened to a service member while they were in service, and it got aggravated once they left the service. You can submit a compensation and claim for any conditions that happen in the service. The only key, this is the only key, is that you need to have a copy of your medical records from the service. So, for example, you have an issue, you got problems with your knee, but and you want to submit a claim because that condition, your knee condition, happened when you were in the service. So you can submit a claim, but you need your medical records from the service showing that that condition happened when you were in the service. Otherwise, the chances of you getting anything for that condition are really slim. So the number one thing that everybody has to do is get a copy of their medical records from the service, and based on those medical records, they can submit claims. Because you can claim conditions that happen after the service, but nothing's going to happen with those. Trust me. So again, the basics. One of the basics about submitting a claim is to have a copy of your medical records from active duty. Once you have your medical records from active duty, review all the conditions for which you were seen when you were in the service, and you can submit claims for those. The other thing that I always tell veterans is that if they have a copy, if they have one copy of their medical records, make sure that they make copies, because you never know. You can end up losing those hard copies. Or if you have hard copies, you might want to invest a few dollars on a scanner and maybe scan those copies and save those on digits. That is one thing that I learned over the years, because with hard copies, you never know. Anything can happen to those. Now, once you become service connected, whether it is 10%, 20%, or 50 or 60%, there is a lot of other benefits that come with that. For example, if you are at least 10%, then you can submit for that is if you have a property. If you got a house, you got a property, and you are at least 10% service connected, you can submit for tax exemptions, meaning that you're going to be paying less in property taxes. That is a huge benefit. Now, the other benefit that I know you guys know about this is the GI Bill, the post 9/11 GI Bill. So, I mean, the beauty about the post 9/11 GI Bill is that you get that BAH money, and I know that in Miami, at least for Miami or South Florida, the BAH is high. So it is a huge benefit for everybody. Now, anybody has any questions?
What do you think, like, the biggest, like, problems that veterans face when they're trying to go through the VA, and, like, what can they do to make the process, like, easier?
Well, you know, I'm also a veteran. So I remember when I left the service, when I retired out of the service back in 2008, and like any other veteran, my first stop was the VA. And it was kind of intimidating at the beginning because, you know, you get into this place. I mean, the VA hospital is huge. And it is intimidating. But I think that every veteran has to go out looking for and looking out for assistance. You guys need to ask questions, because if you don't ask questions, you don't go out looking for those benefits. Those benefits are not gonna be coming to you. Meaning that at the VA, or you guys gotta ask questions to to anybody that works at the VA, because if you don't ask questions, you might end up missing a lot of those benefits. Um, like any other federal installation, sometimes you're gonna be having those two or three that are not doing what they're supposed to be doing. But eventually, you are gonna get to someone who's gonna be doing things for you. Don't get frustrated at the first no, or at the first barrier. Don't get frustrated, because you'll see that those benefits at the end of the day are really worth it. It took me about 6 years. It took me 6 years to get all my benefits in place, and because I was, I kept whenever I used to submit a claim, whenever I used to request for a benefit, I used to do a follow-ups. I used to do follow-ups either on the phone or in person, but that was me. I was always doing follow-ups, because I see a lot of veterans in South Florida, well, not only South Florida, everywhere, that they submit a claim, they have some issues at the beginning, and they get frustrated, and they don't ask anything about those claims or benefits no more. And then 5, 6 years later, they're asking, back again about the same things that should have been done about 5, 6 years earlier. So, like I was saying, it might be frustrating at the beginning, but it's well worth it.
Thank you.
Any other questions?
I guess my question is, so is there any time restrictions or time obligations to enroll in VA healthcare benefits? And then what's the process like to cancel it? So those are my two questions, I guess.
Okay.
If that makes
So
sense.
there's really no time limits to enroll. But again, going back to my example, why wait? It's only a 5-minute process. Because you never know when you're going to be needing the VA. You never know. It's best just to be enrolled, be on the system, just in case something happens and you need the VA. Now, all you need to do, like I was saying at the beginning, is only do one physical a year. Basically, show your face, hey guys, I'm still alive, I'm here, and I'll see you again in another year. That's all you need to do. And you don't have to spend a dime, because those physicals are free. They're going to do blood work, they're going to do labs. Besides, everybody needs that. So, and it's for free. So I think everybody's got to take advantage of that, enrolled. It's only a 5-minute thing again. And now, it's not that you can cancel it, because it's not like you call them and say, look, I want to cancel my enrollment. That doesn't happen. It's just that once you are enrolled with the VA, you're always going to be enrolled. It's just that you might be getting dropped off the system, but in a way, you're still going to be enrolled. But in order to be in a good standing, you got to do at least one physical a year. Now, another example. This last week, I talked to the wife of a veteran. She ended up calling me. Somehow she found out about my number. What happens is that the veteran, the husband, was involved in a motorcycle accident, and he was an inpatient down at the South Jackson Hospital, if I'm not mistaken. So he was an inpatient there, and obviously he was on the trauma center, so the bill was going to be huge. But the wife called me asking me about benefits and what else he was entitled to, without even knowing that the veteran was enrolled and was registered with the VA. Therefore, the VA was going to be mostly responsible for paying the bill. Now, obviously, once the veteran gets better, we can transfer him back to the VA so he can get his care at the VA. But at least for now, he can stay with South Jackson, and the VA was going to be taking care of most of the time. Imagine that. So those are advantages that every veteran has. But in order to take advantages, that you got to enroll. You never know what can happen.
Go ahead, Mia.
So if a veteran wants to move states, is there anything that they need to do for like their checkups or update the VA on anything, stuff like that?
I'm sorry, can you say that again, please?
So if a veteran decides he wants to leave, they want to leave Florida and go like Colorado or something, is there any, besides like notifying the VA my address changed, do they have to do anything?
Okay, that's a good question. Let's say the veteran is enrolled at the Miami VA, and then something happens and they got to move to California. So once the veteran leaves Miami and goes to California, they got to look out for the closest VA where they're going to be at, and they got to re-enroll back again, and they have to be assigned to a new primary care provider, meaning that once they get to California and they get assigned to a new primary care provider, they got to do a new initial physical with the new VA. So basically, in other words, every time that you move, you got to re-enroll and you got to do an initial physical with the new facility.
Thank you.
Yes, ma'am.
Yeah, great question. Oh, sorry, I just moved my computer. So you mentioned that the requirement is one VA physical a year to stay active in the system. Is there any type of requirement, or what's the process like if you are receiving a disability to maintain that disability status? Because don't you have to get recertified like every couple years, or am I wrong in that regard?
No, once you get a service connection, the service connection stays with you. You don't have to recertify anything. Obviously, there is some service connections that are not permanent. For example, let me see. Sometimes you see soldiers getting out of the service, becoming veterans, and they get a disability rating for asthma. Example, asthma. Asthma is like, it can change in a few years, because sometimes veterans pick up that asthma when they're in the service. Because, I don't know, the barracks, uniform, anything can trigger your asthma. But once you get out of the service, become a veteran, you're away from the barracks, you're away from the uniform. Sometimes the asthma goes away. So there's some conditions that are service connected, but they're not permanent. So, but if they're permanent, there is no recertification. There's nothing that you got to do, because you're gonna keep that as service connection for the rest of your life.
Okay, yeah, that makes sense. So when you have a permanent service disability connection, is that identified in your paperwork? And then if it's service related, like asthma, what's the process like to continue receiving that disability? Like, do you have to get a checkup every year to like maintain that disability, or how does that work?
Well, it's not that you gotta recertify anything, because once you get that a service connection, and if it's permanent, if permanent conditions, for example, if you get a service connection for your knee, That's not going to change that 10% that you're getting for your knee, because everybody knows that your knee is not going to get better. So once you get the service connection for those conditions, it's permanent. You don't have to recertify anything. So now remember, one thing about a service connection is that any money that you get for service connection is tax-free, meaning that no one knows about that money. It's like if you were getting the money under the table. You don't have to pay taxes or anything at the end of the year. That's one of the good things about getting that service connection, because it is money that you get and no one knows about that. But one thing that I always tell veterans is that if you have a high service connection, maybe 40, 50, 60, 70%, it might be on your best interest to be enrolled with the VA and to do at least one physical a year, just to show your face and say that you're still alive and that you are taking care of your medical issues. Because before I came into the VA, like I was saying, I used to work in a military base doing disability ratings, and I saw many veterans getting audited simply because they got a high rating and they just disappear. They disappeared. They got their rating. They never went by the VA. They never got any medical visits anywhere, and they got audited. Because if you're saying that you got a really bad back, then you don't get care in years. So there's something not clicking. The other reason is that it happened in the past that veterans passed away, and someone else was collecting their paychecks or their service connection money. So that's why it's really important to do at least one physical a year.
Hello, I have a question for a friend of mine. So before her year was up, 'cause I know that you can submit claims whenever, but it's more beneficial to submit it within a year of getting off active duty. And during that time frame, they found like a cancerous cyst, and it actually developed into like a really aggressive form of cancer. And so she was trying, and I think that she said that they will not like service connect it. So I guess my question is, why won't they service connect it, or how can she, I guess, go about getting it connected?
All right, let's go by pieces. It is submitting your claims within a year after you get out of the service is probably the smart thing to do. Why? Because you can still use your active duty medical records in order to submit your claim. Now, if you go beyond that year, let's say you wait 2 years to submit a claim, you can still do it. But the only difference is that you will have to provide medical records from the time after you left the service, meaning that you gotta have medical records showing that in the last year or two after you left the service, that condition has gotten worse. That is the only disadvantage. But it is, I recommend everybody that if they get out of the service, do it as soon as possible, because you can still use your medical record from active duty. If you wait, you're gonna have to provide, civilian medical records in this case. Now, in regards to your friend, let me get the picture. Let me understand the picture. So she left the service, and after she left the service, she developed cancer, correct?
Hold on, I'm reading her message right now. I think so. I think so. She got out of the service and then she went to the VA to do like one of her checkups, and they found cancer during that checkup.
Okay. Now, there's a couple of things that we gotta know here now. Is that where was the cancer developing at?
She has brain
Because
cancer.
if she, say that again.
She has brain cancer.
Brain.
Yes.
Okay. Now, if she was never seen, when she was in the service, if she was never seen for that condition, or anything related to the brain, she is. I'm not saying that she cannot submit the claim. She can submit the claim, but the chances of her getting something are very slim. Very slim. Because in order for you to get anything from the VA, you gotta be able to establish that connection between that condition and in your service. And the only way that you can do that is by providing medical records showing that you were seen for that condition when you were in the service. And I found out about that myself, and I found out about it the hard way. Because when I was deployed in Iraq, I fell out of the back of a truck during a convoy, and I ended up dislocating my shoulder. I went to sickle, and all they had on my medical records back then was that I fell out of the back of a truck. They never said where was I at, or what is it that I was doing, or what kind of truck was it. So I was young. I didn't know that much. So I got out. I left the service. And when it was time for me to claim it, they came up saying that all that my medical records were saying is that I fell out of the back of a truck. So it's bottom line, like what I'm trying to say is that it's gotta be on your medical records. Otherwise, you can bring statements from 300 other people in your unit. Most likely, that's not gonna fly.
So I have another question. So from her cancer, she's having like a secondary effect of like losing her teeth. And so she wanted to know if like the VA would actually cover like tooth extractions. I know that unless you're like 100% disabled or if you have like a claim directly related to your teeth, you can't go to like the dentistry there.
Dental conditions are there's only two ways that you can be covered for dental conditions at the VA. Only two ways. Number one is if you're 100% disabled. If you're 100%, then you get that the dental coverage. The second way is by you having a service connection condition, a dental service connection condition, meaning that if you got a disability rating of 10 or 20% for a dental condition, then you get the coverage for dental. So those are the only two ways that you can get coverage for dental. If you have a dental issue that is secondary to another condition, the most likely that's not going to happen.
Okay. This is well. I'm not gonna say this is my last question. I think I have another one. So, how do you prove like some cancer is like service connected? Like, do you have to like do like the what is it, the burn registry, or you have to prove that you were in like a toxic environment or something of that nature?
Let me see. I think that will be a really good question for maybe she can talk to her physician, because she can let the physician know where she's been stationed at, or whether there was other issues where she was stationed at, and maybe the physician can establish a connection between the condition and in where she was stationed at. Maybe that's one way. Because if you don't have it on medical records, or you don't have it on paper stating that the physician saying that maybe this condition is due to the fact that she was on I don't know, she used to work with a lot of asbestos in her unit or anything like that. There is no way that you can get anything. Somehow you gotta have medical records connecting your condition to the military. You gotta have that. And see, I don't know, when did she get out of the service?
I think it was about 5 years ago.
And now she's now just developing the cancer.
No, she developed the cancer. Well, they discovered the cancer within her first year of getting out of the condition. Like 7 months after she got out active duty, that's when the cancer was picked up on, like, I think like her ultrasound or something, because she found out she was like pregnant. And so she did, not her ultrasound, she did some testing, and then like they found out she was pregnant and that she had like brain cancer at the same exact time.
Well, I mean, one other thing that we can do is maybe you can give her my number, you can give her my contact information, and maybe she can give me a call and see, I mean, what other stuff we can do or what other benefits she might be eligible for. That's another option. And at this point, I don't even know if she's service connected or not. So it might be best if I talk to her and find out more about what's going on. Is she in South Florida or is she somewhere else?
I think she's from South Florida, but her husband is still active duty, so she lives in, I think, North Carolina.
Okay. But that's what I recommend her do. I mean, she can still submit a claim, but she needs to establish that condition. There's got to be a link between that condition and her active duty time or where she was stationed at. There's got to be a link. And the only thing that the VA is going to take is if a physician establishes that link. So.
Thank you.
Yes, ma'am.
I know I personally don't have any more questions. I don't know if anybody else does, or if you have any other information you would like to provide us, sir.
I think I don't know if everybody has my contact info. You
Yeah,
can always give me a call. Shoot me. Go ahead, man.
Oh, I apologize. If you would like to drop it in the chat, so everybody can see it, and then maybe just say it since this is being recorded, so everybody does have your contact information.
Yes, I'll drop it off on the chat. But just give me a call, shoot me a message. If you guys have any questions, issues, or anything that has to do with the VA, and spread the voice. I mean, I know college. Usually, college are most of the vets are kind of young. They don't really think about healthcare, but it's necessary. It's everybody got to register, got enrolled. Because I mean, you never know. You never know when you're gonna be needing the VA, or like I was giving that example about that motorcycle accident. I mean, the guy got lucky because he was registered with us. He was enrolled, and so therefore he wasn't gonna be kind of worried about the tab. So, just something for you guys to think about. There you go. It's on the chat now, my contact info. So if anybody wants to reach out, give me a call, shoot me a message, email me. Please do so.
Great. Thank you so much for your time, and the information that you provided us today, sir.
Yes, ma'am.
Thank you again.
You very welcome, and everybody stay safe, please, and give me a call if you guys need anything. Okay.
You too. Thank you and have a great day,
Thank
sir.
you. You too.
Bye.